be your nurse today. Do you mind if I do an assessment on you?
Nope, go ahead.
I've already washed my hands and provided for privacy. I've already completed my general survey. I looked at his appearance versus his age, his nutritional status, his overall demeanor. I did his vital signs and I assessed his pain, and I did a mental status examination. Do you mind having your shirt off during this examination?
Nope.
Do you mind telling me your full name?
My name is Derek Allen Deshawn.
Do you know what day it is?
It is November 22nd, 2015.
And do you know where you are right now?
Kelsey's house.
Alright, again, I'm going to wash my hands, and then I'm going to do a skin assessment on you. So I'm just looking at your skin, checking your turgor, looking at your nails. Do the same over here. Inspecting and palpating it. And I will continue my skin assessment throughout the examination. So next I'm going to look at your head. I'm going to look at your scalp, feeling for any tenderness, inspecting for any abnormalities, no tenderness.
Nope.
Looking at your face. Then I'm going to look at your ears. Inspecting to make sure there's no abnormalities. And now what I want to do is a whisper test on you. So what I'm going to do is I'm going to whisper 4 numbers in each ear. And I want you to repeat the numbers in the exact sequence that I whisper them to you. Can you do that for me?
Yep. 6498. 327.
What was the 4th number?
7.
327? Let me try it again.
6584.
That was better. Alright, so now what I'm going to do is I'm going to do an assessment on your eyes. I'm looking at your pupils, making sure they're reactive. So what I'm going to do is use a pen light. I just want you to look straight ahead. Just making sure they're reactive. Okay, now what I want you to do is just stare straight ahead at this pen light, and then I want you to look off in the distance, and then look back at the pen light. Okay, and now what I want you to do is just continue looking straight forward, and I want you to follow it, okay?
Okay.
Now what I'm going to do is wash my hands and put on some gloves. I'm going to go ahead and inspect your face, palpating your sinuses, the maxillary and the frontal, looking at the cornea, the sclera, and now I'm just going to palpate down your nose. No tenderness here.
Nope.
Okay, inspect the nose. Alright, I'm going to take my gloves off and wash my hands. And now what I want to do is check the patency of your nares. So what I want you to do is occlude one nostril, and then in the other one I want you to breathe in and out. No problems there. And now can you do the other one? And no problems there?
Nope.
Okay, I want you to give me a smile. Puff out your cheeks. And I want you to lift your eyebrows. Can you stick your tongue out? Move it all around. Okay, and then what I'm going to do is just check the muscles in your jaw. You can go ahead and close your mouth. And I want you to clench your jaw. I'm just feeling the muscles. Don't feel any kind of gritting, any cracking there. Okay, so I'm going to wash my hands again and put on some gloves. I'm going to go ahead and inspect your mouth, okay? I'm going to use a tongue blade and some gauze. So can you go ahead and open up for me? First I'm looking at his lips, making sure there's no cracks, no lesions. Looking at the tongue, looking at the oral mucosa, looking at his soft palate. Okay. So I have a tongue blade and some gauze here. Go ahead and open back up for me. Just gonna go palpate the tongue, lift it up, looking for any abnormalities. Okay. Now I'm gonna use my pen light again. I'm gonna look at your uvula. All right, can you say ah for me? Okay. And I'm gonna go ahead and wash my hands again. So now what I wanna do is do an assessment of your thyroid. So I'm just gonna be palpating it. No tenderness here.
Nope.
Nope. Okay, and now what I want you to do is I want you to take a sip of water and I want you to hold it in your mouth for me.
Okay.
All right, and now I want you to swallow it. Okay. So now what I want to do is see if you can determine light touch, and then I want to determine if you can differentiate between sharp and dull touch. So first what I'm going to do is do light touch. So this is a cotton ball. You can go ahead and feel it.
Okay.
What I'll have you do is just close your eyes, and I'm going to touch this to different parts of your body, and I just want you to tell me where you feel it at.
Alright.
Okay, go ahead and close your eyes.
Left cheek, right cheek, chin, forehead, nose, right shoulder, left shoulder, right arm, left arm, right arm, left arm, right hand, left hand, right knee, left knee, right leg, right foot, left leg.
Okay. So now what I'm going to do is check your ability to differentiate between sharp and dull pressure. So I have a Q-tip here, and I want you to feel it. This is going to be your dull, and this is going to be your sharp.
Okay.
And what I want you to do is I'll have you close your eyes again, and I want you to tell me if you feel sharp or dull pressure, okay?
Okay.
Go ahead and close your eyes.
Dull, dull, sharp, dull, sharp, dull, sharp, dull, sharp, sharp, dull, 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 sharp, dull, dull.
Okay, you can go ahead and open up your eyes. And now what I'm going to do is palpate your lymph nodes. So first I'm looking at the preauricular, the postauricular, the occipital, submental, submandibular, the tonsils, the cervical chain, supraclavicular, and the infraclavicular. And then what I'm going to do is look at your axillary nodes as well. So I want you just to lift your arm up. And I'm just going to palpate these. Palpate the 4 axillary nodes. And then what I'm going to do is do the inguinal nodes. I'm going to wash my hands again. And now what I want to do is I'm going to auscultate your lungs and do the lung assessment. And actually before I auscultate, what I want to do is just assess your chest. So I'm going to look at the front, just inspecting it, making sure there's no abnormalities. I'm going to check for chest expansion. Can you take a deep breath? Okay, so I'm going to go ahead and percuss. And now I'm going to go ahead and listen. Take a deep breath. And let out. And then what I'm going to do is, while I have you facing forward, I'm going to go ahead and assess your cardiovascular system. So first I'm just going to palpate for any thrills. And I'm palpating for the apical pulse. Okay. And now I'm going to go ahead and listen to you. My stethoscope has a diaphragm and a bell on the same exact side, so I'm just going to differentiate between when I listen with the diaphragm and the bell. First I'm going to do the diaphragm, aortic, pulmonic, tricuspid, mitral. And now with the bell. Okay. And now what I'd like you to have you do is just flip around on my table. You can just face towards the back. Okay, and so now what I'm going to do is assess the posterior chest. So again, I'm just looking for some symmetry. Going to go ahead and look at the spinal column. And then I'm going to check for chest expansion again. Take a deep breath. And then I'm going to go ahead and percuss. And now what I'm going to do is check for CVA tenderness. So what I'm going to do is I'm going to hit your back just a little bit. It's not going to be hard. Just let me know if you're feeling tenderness. Any tenderness?
Nope.
Any tenderness?
Nope.
Okay, so now I'm going to go ahead and auscultate lung sounds. Take a deep breath. Okay, and now I'm going to go ahead and have you flip back around if you don't mind. Alright, and I'm just going to check the strength of your trapezius and your sternocleidomastoid muscle. So, what I want you to do is I'm going to place my hands on your shoulders here, and I just want you to lift up against the resistance. Go ahead. Put them back down. And again. And back down. Okay, and now what I'm going to do is just place my hand on the side of your face, and I want you to go towards my hand and try to push against my resistance. Okay. Good. No problems there?
Nope.
Alright, so now what I'm going to go ahead and do is assess your pulses. I'm going to start off with your carotid pulses, and I can't assess those both at the same time, so I'm just going to do them all individually. So carotid pulse. brachial. The radial. Then I'm going to look at the femoral. I'm going to look at the pulses in your feet. I'm going to go ahead and wash my hands. So now what I'd like you to do is go ahead and lay back on the bed if you could. I'm going to go ahead and do my abdominal assessment. First off, I'm just inspecting the abdomen, making sure there's no distension. And now what I'm going to go ahead and do is auscultate the bowel sounds. And he does have bowel sounds present in all 4 quadrants. So now what I'm going to do is percuss. And for the next part of my assessment, I'm going to go ahead and do some light and deep palpation. So if you feel any tenderness, just let me know. Starting off with light. And now I'm going to do deep. No tenderness there?
Nope, all good.
Okay. Do you remember when your last bowel movement was?
Yeah, this morning.
Okay. Normal bowel movement?
Yep.
Okay. So now for my next part of the assessment, I'm going to go ahead and check your musculoskeletal system. So as I'm doing this, I'm going to continue my skin assessment. I'm going to look at range of motion of all the joints, and I'm going to palpate for tenderness, swelling, crepitus, and temperature. So first I'm going to start off with the arm, looking at the shoulder. If you feel any tenderness or any resistance, just let me know. And now we're at the elbow, and now the wrist, the fingers. I'm looking at cap refill as well. Okay, now the other one, looking at the shoulder, the elbow, wrist, fingers, and checking for cap refill over here as well. Do you have good movement of your neck? You can move it back and forth.
Yep.
No tenderness, no.
Nope.
Okay. Now moving on to the hips, making sure he's got good movement. I'm gonna go ahead and lift your legs up. Good. Making sure he's got good movement of his hips and knees. And I'm just going to look at your ankles, checking your toes. And get on this one. Go ahead and lift your Good movement of the hip. Okay. Looking at the knee again. And the ankle. Good. And looking at the toes. Okay. So now what I'm going to have you do is sit back up on the side of the bed. And I'm going to go ahead and I'm going to wash my hands again. And now what I'm going to do is check for reflexes. So first I'm going to do the bicep. Good. And I'm going to move on to the other side. Good. And now I'm going to look at your patellar reflex. Okay. Okay. And so now what I'm going to have you do is I want you to put your arms out in front of you. Okay. And now what I'm going to have you do is checking the flexion of the wrists again. I want you to go ahead and close your eyes. And I'm checking the Romberg test to make sure he doesn't have pronator drift. Okay. You can go ahead and open your eyes and put your arms down. So next what I want you to do is I want you to stand up. And I'm going to have you do a heel to shin. And what I'm going to have you do is lift up one leg at a time, and I want you to start on the opposite knee, starting at your knee, moving down to your ankle.
Okay.
With your heel.
Like that?
Yep. And then the other one. Okay, and now I want you to take a finger, and I want you to bring it to your nose, and then move it back. Okay, and the other one. Okay. And now what I want you to do is turn and face the wall. Bend over for me. Again, I'm assessing the skeletal with the spinal column. And now I want you to go ahead and take a walk. Lift up and take a walk. Okay, and I'm just assessing his gait, his mobility. Okay, and no problems there?
Nope.
Okay, this concludes my assessment. I'm going to go ahead and wash my hands. Thank you.